He's got his fist right up against his face and he's like holding his mask. Like, I don't want to wear this. I was 26 weeks and 3 days. We went to the hospital in Aurelian, got rushed here right away. They thought I was having the baby that day.
Yeah, it was like scary. We went to Aurelian, and then as soon as they measured her cervix, they were like, well, we need to send you guys to either Toronto or Ottawa.
There are many reasons why a baby might be admitted to the NICU, from being a sick term baby or a preterm infant who may be fragile and sick and needs support in their development until their due date. Many parents describe the NICU as like entering a spaceship. This sort of environment is so out of their normal context that they really feel completely disorientated and scared when they arrive in the NICU.
Family integrated care started as a pilot study in about 2010-11, involving the parents as part of the healthcare team. So they do make the decisions. There's family meetings that they participate in. They do rounds in the morning. So they're much more active in their baby's care and they get to know their baby really well. So when they're ready to go home, they're not going home with a baby that they've just started caring for. They've cared for that baby during that baby's whole transition in the neonatal intensive care unit.
Yes, I have to take.
We gotta get the milk and stuff.
Yeah.
Family integrated care is actually a change in paradigm. It's a different way of providing care than what we have been used to in the hospital to babies. We actually put the parents in charge. And we said to the parents, well, you tell us how we can make this work. What can parents do? How do we teach them? How do we teach the nurses to teach them? And so on. And then we piloted it, we tested it, showed that in fact it can work. And not only that it can work, but in fact it was of benefit to both the parents and the babies.
Lots of friends.
Yes.
Okay.
He's had a good night. Do you do his diaper and temperature and everything? Yeah. Perfect. If we do that, that'd be great. Yeah.
You wanna go or you want me?
Yeah, you're gonna hold him saltier. You're so calm.
As Ashley and Jake prepared to take Grayson home, my role would be preparing them for that at-home piece, and that would be the developmental aspects that need to be maintained. There were a lot of things that were done in the hospital that need to continue on when going home.
A lot of it is dependent on Jake and I, and us knowing how to handle like his oral medications and making sure that we know his cues and know like that he's getting enough food. He realistically won't be discharged until he's off of the high flow, which hopefully sooner rather than later. I don't expect him to be discharged until his due date, so anytime before then would be a surprise.
You might need to get getting in your way.
So what hand are you more comfortable with?
I'm good with this.
Perfect. So what we can do is hold him close to the boy. I know it's kind of awkward because it's low. And then with your hand, we can just kind of splash and kind of wet his head. You don't like it.
I know.
And I got these cloths too. It's your own preference. You can wet the cloth and kind of squeeze it on his head or use your hand.
Hi.
Perfect. I just want to make sure we're not getting any water in his ears. What's going on, Grayson? Does that feel nice? No? So just make sure when you're doing his eyes, you want to go from the inner part of the eye to the outside. And just use a different corner of your cloth when you do that. And there's lots of cloths here if you want one. Oh, that feels nice. Does that feel nice? He's thinking about it now.
Close your eye. Close your eye.
Initially, they may only be able to give their baby a hand hug in the NICU, but over time they progress to being able to do skin-to-skin care, initially facilitated by the medical team or the nursing team, but then further along being able to actually take their baby out themselves and hold their baby and start feeding themselves. So that's a huge progress from admission to prior to discharge.